Hi everyone, my name is Dan Clanton, and the purpose of this video is to provide you an orientation to the issue of cross-cultural religious literacy in healthcare to prepare us for our joint session with Professor Sprouse's class, Ethics in Healthcare. So why is it important for us to consider religion in learning about and practicing healthcare? Maybe the question is better put differently. Maybe we should be asking, why is it professionally useful and necessary to incorporate cross-cultural religious literacy into your training for healthcare fields? As I see it, there are four big reasons. First, cross-cultural religious literacy is an important skill within a liberal arts education. This is because a liberal arts education trains you to view central issues through a variety of lenses or academic disciplines. What we're doing in this class session is an excellent example of that aspect of a liberal arts education. Because of that interdisciplinary training, a liberal arts education also provides you with professional skills that employers want, like analytical and critical thinking skills, the ability to communicate effectively and problem solve, not to mention research and creative thinking skills and experience in project management. Learning and practicing cross-cultural religious literacy is also helpful in thinking about and shaping public healthcare policy. This could be local or global. Locally, for example, the Nebraska Department of Health and Human Services enforces regulations outlined in the Let Them Grow Act, which was passed in October of 2023 and renewed 2 months later. This act, and I'm quoting, prohibits surgical procedures for youth under 19 and regulates the use of pharmacological treatments such as puberty-blocking drugs for patients under the age of 19 seeking treatment for gender nonconformity and/or gender dysphoria. Nebraska also bans abortions after 12 weeks. Because both of these public health care restrictions are laden with religious understandings and motivations, a greater awareness of how different religious cultures conceptualize and act on these issues is key to ensure that a specific religious viewpoint isn't privileged in these discussions. Globally, the United Nations has a goal called Agenda 2030, which contains 17 Sustainable Development Goals. Number 3 is good health and well-being. As Christine Schleiser points out, clearly the role of religion in such an endeavor is absolutely key, as in many areas, faith-based health providers are the only game in town, so to speak. Also, religious leaders can be important resources in mobilization and disseminating accurate information and reinforcing the need for various treatments. Alternatively, religious leaders and organizations can seriously impede effective and timely treatments. You can see more information about this Agenda 2030 on these two subsequent slides, and I'd invite you to pause the video and take a look at them as best you can. A third reason this is important is that y'all will 100% encounter diversity in your practice. Remember, diversity isn't a matter of opinion, it's just math. You will be in situations where you'll have to treat people who orient around religion differently. The question then becomes, how will you respond to this diversity so you can treat the whole patient respectfully? As Carolyn Roncolato writes, health professionals need new skills, experiences, and literacy to notice, engage, and attend to the religious diversity they inevitably encounter. Roncolato also points out that you can't know everything about everyone's religious practices and beliefs, but learning about cross-cultural religious literacy can help you develop what she calls a radar screen to learn how to ask questions to draw out the religious, spiritual, and secular identities of your patients and clients. Developing this radar screen not only involves gaining cross-cultural religious literacy, but it should be part of your professional training. In fact, there's already a resource called the FICA Spiritual Assessment Tool that aims to train healthcare workers to develop this radar screen by taking a spiritual history alongside a medical history. FICA is an acronym, as you can see, to help remind professionals to ask patients about their faith and belief, how important that is in their treatment, whether they identify with a community, and how they'd like these issues addressed in their treatment. There's also a tool called a HOPE spiritual assessment resource that encourages professionals to delve more deeply into their patients' religious, spiritual, or secular identity. Another key reason for incorporating cross-cultural religious literacy into your healthcare training is to advance the goal of health equity. That is, overcoming bias in dealing with diversity and inclusion in healthcare. As Carolyn Roncolato writes, studies show that the same groups who are disproportionately affected by healthcare inequities, African American, Latina, Latino, Latinx, rural, low income, and other minority ethnic identities, are also more likely to actively participate in a religious tradition than other population groups. These findings suggest that understanding, valuing, and recognizing religion is an important part of providing equitable care and increasing health outcomes for people with marginalized identities. We should always ask, so what? Why is this important for us to know? Well, there are a couple of answers to that question. First, there's a selfish answer. Learning about cross-cultural religious literacy will be good for your career. It'll help you stand out among other applicants, and it will show your patients and clients that you care about and are sensitive to their whole identities. Another reason is that cross-cultural religious literacy is also a key skill in your liberal arts experience. It'll make you a more culturally attuned and literate student and a more interesting human. So, how do we gain and practice this cross-cultural religious literacy? Doane University offers courses that allow you this opportunity, but doing what we're going to do in our session is also important. To further understand the importance of cross-cultural religious literacy, we're going to be engaging in some case studies that'll highlight this aspect of treatment and will hopefully help you think more critically about that radar screen I mentioned a few minutes ago. Again, this is Dan Clanton, and I surely hope this has been helpful. I look forward to working with you.